Welcome. Today we're diving into a rare and complex lung disease known as Lymphangioleiomyomatosis, or LAM. This condition primarily affects women and can lead to serious breathing difficulties. Join us as we explore its cause, effects, and current approaches to management. The exact cause of LAM remains somewhat mysterious, but we know it's linked to mutations in the TSC1 and TS2 genes. These genes produce proteins, hamartin and tuberin, which regulate cell growth and division. When these genes are mutated, cells, specifically abnormal smooth muscle cells called LAM cells, can grow uncontrollably, particularly in the lungs, lymph nodes, and kidneys. It's important to note that LAM can occur sporadically, meaning without a known family history or an association with tuberous sclerosis complex, a genetic disorder that causes tumors to grow in various organs. LAM's harmful effects center on the proliferation of these abnormal LAM cells. These cells infiltrate the lung tissue, obstructing airways and damaging the alveoli, the tiny air sacs responsible for gas exchange. This leads to the formation of cysts throughout the lungs. Additionally, LAM cells can obstruct lymphatic vessels, impairing fluid drainage and causing fluid buildup, called chylous effusions in the chest or abdomen. This obstruction of the lymphatic system is how it received its name, Lymphangioleiomyomatosis. LAM is a rare disease, primarily affecting women of childbearing age, typically between 30 and 40 years old. Its estimated prevalence is between 3 and 7 cases per million women. While it can occur in women of all ethnicities, studies have shown some variations in prevalence across different populations. Because it is rare, diagnosis is often delayed. The symptoms of LAM can vary significantly from person to person, depending on the severity of the disease and the extent of lung involvement. Common symptoms include shortness of breath, particularly during exercise, chronic cough, sometimes producing phlegm or blood, chest pain, and recurrent lung collapse, also known as pneumothorax. Some individuals may also experience fluid buildup in the chest or abdomen, leading to swelling and discomfort. Because these symptoms can be caused by more common conditions, accurate diagnosis is often delayed. Diagnosing LAM requires a combination of clinical evaluation, imaging studies, and sometimes lung biopsy. A high-resolution CT scan of the chest is a crucial tool, as it can reveal the characteristic cysts distributed throughout the lungs. Pulmonary function tests help assess lung capacity and airflow. Measuring serum VFD levels can also be helpful, as elevated levels are often seen in LAM. In some cases, a surgical lung biopsy may be necessary to confirm the diagnosis, allowing for microscopic examination of the lung tissue to identify LAM cells. While there aren't distinct subtypes of LAM, the disease is often classified based on its association with tuberous sclerosis complex. Sporadic LAM occurs in individuals without TSC, while TSC-LAM occurs in those with the genetic disorder. The disease severity and rate of progression can also vary, with some individuals experiencing a relatively slow decline in lung function and others facing more rapid deterioration. Currently, there is no cure for LAM, but treatments are available to manage symptoms and slow disease progression. The mTOR inhibitor, sirolimus, is a key medication used to stabilize lung function and reduce the growth of LAM cells. Bronchodilators can help open up airways and ease breathing. Oxygen therapy may be required for individuals with severe shortness of breath. In cases of recurrent pneumothorax, surgical interventions like pleurodystis may be needed. Lung transplantation remains a viable option for patients with advanced LAM who haven't responded well to other treatments. Supportive care, including pulmonary rehabilitation and smoking cessation, is also crucial in managing the disease. Unfortunately, there are no known methods to prevent the development of sporadic LAM. For individuals with tuberous sclerosis complex, genetic counseling is essential to understand the risk of passing the condition on to their children. Early diagnosis and treatment of TSC-related manifestations may also help prevent or delay the onset of TSC-LAM. The prognosis for individuals with LAM can vary widely, but with proper management, many can live relatively stable lives for many years. The rate of lung function decline can differ significantly. Ongoing research is focused on developing new and more effective treatments. Studies are exploring novel therapeutic targets, such as other signaling pathways involved in LAM cell growth. Clinical trials are constantly evaluating new medications and approaches to improve the quality of life for individuals living with this challenging disease.